Okay, I'm here to talk about RPR, the Reflexive Performance Reset overhead fixes for the squat, the overhead squat. I will give you level 1 and level 2 fixes. These are immediate fixes. As with RPR, people have realized that you get instantaneous fixes and not spending weeks or months trying to fix the issues. And more information can be found at reflexiveperformance.com there. Now, then, obviously posture is an important thing, but one of the issues in the squat would be, example is forward head posture, but also just poor posture. Now, remember, these are all problems. Rounded shoulder are signs that you have chest breathing issues and various fascia problems, poor head posture. Thoracic is tight in that area, you have some back pain. Now, the biggest one fix for the overhead squat, it would be lower and upper body fixes would be the breathing. As you know, if you've attended the RPR courses, that all this fascia being bound up causes many of these problems. The one thing that separates RPR from everybody that does all these breathing exercises, that we release the fascia to allow the breathing exercise to happen. Well, we don't even worry about the breathing. Once you release the fascia, the body kicks in and breathes correctly on its own. The athlete would do their zone 1 breathing, the upside down Y, and then get a huge fix. Now, the common limitations, obviously we know for the upper body, is limited shoulder flexion, limited shoulder external rotation, poor thoracic spine extension, spinal erector activation, anterior core stiffness, stiff neck and mobility. Lower body is the hip flexors, glutes, hamstring, lateral sling, calf mobility. These are all common limitations in the overhead squat that can be fixed with RPR. So after your breathing, we know that the next fix for the athlete to do to themselves would be the psoas, which then understand is important for the stability of the hips. The reason the psoas is important for stability of the hips is because if the psoas is not functioning correctly, it will revert to its main job, which is then the ability to stabilize the hips, or the stabilize the spine. Okay, and to do it under load is a big deal, and often the psoas may function at light loads differently than heavy loads. So there's low level tolerance and high level tolerance to stress with these tissues, as you know by taking the RPR courses. RPR glutes, the biggest thing that people don't understand is that the hip extension pattern is for pure hip extension, not the various phases, which I'll address later in common misunderstanding in another video. The drive of hip extension and coming out of squat. This is important. Now, these two work together for stability of the hips completely. And the biggest thing people misrepresent is they think everyone's core is unstable. Newsflash, the core is not unstable 95% of the time. I've actually never found it. If the hips are unstable, the core cannot be stable. The hips, the core is connected to the hips. So I know there's been entire empires in the fitness world developed off core training, but I truly believe they're wrong because the hips aren't stable and are dysfunctional. Enough of that rant. In the zone 2, the hamstring is a big fix, okay, for your overhead squat, especially if it's tight. As you know, the reason the RPR works on the hamstring and a majority of all the muscles is that if the hamstring's long and weak, it can't get a full contraction. If it's shortened and spasmed, it still can't get a full contraction. So what RPR, the reflex point, does is when you hit the reflex point, it goes to the brain, gives it feedback, and the hamstring then goes to that sweet spot for maximum contraction and mobility. Now the next one is the calf. And with that mobility, you also want to make sure that you hit the calf in the overhead squat. The quad is another fix for level 1, not as important as these, but quite often this can get some more mobility, because what happens is the quad actually being tight and tense can pull the hamstrings into having more tension. Now, the hip shift valgus knee. Again, I fix this in a matter of seconds with my athletes. Level 1, you're just hitting the lateral sling, or we often call it the hip. So you can see that shift right there. Yes, it can be fixed in seconds, not weeks on an exercise program. The biggest thing with the hip shift, you can have flat feet, which will cause this valgus. The heels raise off the floor. The reason the heels would raise off the floor, because if the hips lack stability, the body tightens up all over, and what transpires is the tension in the muscles. So if you have some instability or dysfunction somewhere, other areas tighten up, and it can appear that the joints lacks mobility, but it actually may not when you release or stabilize the various parts, and you understand this after going to the RPR. And again, all I would do on this particular hip shift is, what you realize is this glute is activated, or glute med, then it's pulling this way, and this one is not activating correctly. So you would hit the right side, the opposite side towards they shift. They shift left, you're going to hit the right side with your level 1 activation. Now, core fixes. I know I went off on a rant, but again, people, notice the core is fixed to the hips. I've checked many cores that are weak. When the hips become fixed, the core instantaneously becomes strong. This core cannot be strong if the hips are dysfunctional and can't stabilize it. End of story. I've only seen it. I know scientists might disagree with me, but every time these scientists argue with me, I ask them how many people have they fixed or coached, and it's usually 0 to none. So the biggest fix would be the abdominals level 1 fix, and then actually this is level 2 fix. The spinal erectors, along with the breathing, is often a common core fix. Upper body fix, tight lats can be an issue with your overhead squat. Make sure you release the lats. The rest of them, the other part of the upper body fixes would be your shoulder and the supraspinatus. And again, the athletes can fix this. I actually need to go back here also. The spinal erectors would be the anti-rotation, which is the only level 1 that the athlete can't do. It will also help with this. Now, reminders, this breathing, remember, if you actually look at this now that you've done shoulder supraspinatus and the breathing release by yourself, what people have to realize is, again, that all the fascia is pulled forward, your scaps aren't going to work correctly. If your shoulders are rolled forward, people do all this scap work and they think it's getting better, but it's only getting better part of the time. If you release all the tissue in the front, the anterior part of the body, then the scaps automatically turn on. Now, another fix for the neck would be, or the overhead upper body fixes, is, again, if you address the neck, which causes a bunch of tension in the upper body, to probably cause issues with this overhead squat. Now, level 2 RPR fixes. Basically, if you've gone to the level 1, you know that the athletes can fix it themselves, and the coach can if needed. Now, the level 2 is more practitioner based. You would definitely hit quads level 2, the cheat disruption pattern, as you know it. The 1, 2, 3 back zone is a major contributor. The QL disruption pattern, when the QL is a primary firing pattern for hip extension. The abductor magnus for the hamstring spot on level 2, the pubic bone reset, and the piriformis reset for RPR level 2. Those are the common fixes for the overhead squat. As a biomotor ability, if you value this lift and your athletes can't perform it correctly, and that could be day to day due to injuries, RPR can fix it in a brief few seconds.